Hello everyone. Today we will discuss about the next NCLEX practice based questions. So let's start our first question. What are the signs and symptoms would the nurse expect to observe a client diagnosed with a brain tumor? Select all that apply. So let's see about the condition given and the strategy. So condition given, brain tumor in child. So we have to find out the sign and symptoms. So it is a SATA based questions in which we have to select all the sign and symptoms related to brain tumor. In child. So let's see the options: skin rash, nausea and vomiting, joint pain, fatigue and lethargy, increased appetite, elevated pulse rate, excessive thirst, vision, hearing or speech changes, seizures, headache, shortness of breath, and head tilt. So let's solve this question. So firstly, we have to know about the brain tumor. Like, what is brain tumor? So it is an infiltrations below the tantrum cerebri tumor. The most common brain tumor is located in the posterior third of the brain, primarily in the cerebellum or the brainstem, and accounts for the frequency of symptoms resulting from the increased intracranial pressure. So we can say that there are the different type of the tumors in the children that are in the different locations, and there are the different type of the tumors lead to the different type of the symptoms. So here we know about the tumor or the abnormal growth in the brain is called a brain tumor, and it depends on the regions. So while assessing the child with a brain tumor, there will be certain sign and symptom observed. Okay. So firstly, see the parts of the brain. It is the top view and it is the lateral side view. So in this side, there is a left cerebral hemisphere and right cerebral hemisphere. And in the side view, there are the lobes like frontal lobe, temporal lobe, brainstem, parietal lobe, occipital lobe, and the cerebrum. So these parts are brain responsible for the different functions you can see here. Like firstly discuss about the top view. So left cerebral hemisphere and the right cerebral hemisphere. So left cerebral hemisphere control the right side of the body and the speech, and right side control the left side of the body. Okay, we all know this condition. And in the side view, like here, you can see this differentiation with the colors: frontal lobe, parietal lobe, occipital lobe, medulla, pons, temporal lobe. So here the frontal lobe controls are the personality, movement, and sense of smell. Parietal lobe is responsible for the identification of the objects, sense of pain, touch, body navigations, and the spatial position. And the temporal lobe is basically responsible for the memory, speech, and the musical rhythms. Occipital lobe is responsible for the vision. And here the brainstem parts, the pons, medulla, control the eyes and the face movements, and medulla control the heart and the lung, basically the respiratory center. So these all are the parts of the brain that are responsible for the different functionings. So we can easily identify when the tumor in the different location. You can see here, like if the tumor in the frontal lobe, there will be the symptoms regarding the personality, movement, and the sense of smell. If the tumor located in the parietal lobe, it will be responsible for the identification of the objects. Like you can say that patient or the child not able to recognize the objects. He maybe lost the pain and the sense of the pain and the touch. And if there is a tumor in the occipital lobe, the child will not able to see, or maybe he have a blurred vision or the different vision problems. And if the tumor located in the temporal lobe, then we can say that the child is not able to things kept in the mind. Maybe his memory is impaired. Maybe he not able to speak out. Okay, so there are the different lobes responsible for the different functions. And if the tumor will variate in the one of any lobe, then the symptoms will lead. But here the main thing is that if the brain tumor, I'll explain you in the next slide. Okay. So we can say that in most of the cases in the brain tumor, lead to increased intracranial pressure. Okay. So we know that when the intracranial pressure will be increased, there will be different symptoms that come from the increased intracranial pressure. Okay. So we can say that of how the ICP caused. So how the brain tumor can cause the ICP. So it can be result by the extra tissue or the fluid in the brain. So brain tumor means there is an abnormal growth. Okay. There will be the abnormal growth in the brain. So automatically there will be the extra tissues. And whenever there will be the extra tissue or fluid in the brain, that lead to the increased intracranial pressure. And the pressure may increase because of the ventricles that drain the cerebrospinal fluid. We can call it the CSF, and has been blocked and causing the fluid to be trapped in the brain. So symptoms lead to the increased intracranial pressure, like some of the main symptoms like headache, nausea, personality changes, irritability, depression like symptoms, and decreased cardiac and respiratory functions. So these are the main symptoms that come from the increased intracranial pressure. So thing to be noted here, because I have explained you that how the intracranial pressure increase in the ventricles or in the brain due to the extra fluid or the extra tissue growth in the brain. So in brain tumor, I have explained you that it is abnormal growth in the brain, abnormal growth of the tissues in the brain, and the increased intracranial pressure lead to some symptoms like headache, nausea, personality changes, irritability, depression, decreased cardiac and respiratory functions. And one thing also here, there are the signs and symptoms related to tumors in different location. Okay. So we can call it, if the brain tumor in the cerebrum, maybe it may be into the tumor develop in the cerebrum. For example, okay, tumor located in the brain stem, tumor located in cerebellum, so there will be different symptoms occur like in the cerebrum. So it lead to the seizures condition, like visual changes, slurred speech, paralysis of the weakness of the half body, intracranial pressure increase, drowsiness, personality changes. So all these symptoms related to the cerebrum. And if in the brainstem, so I have explained you that brainstem is mainly responsible for the heart and the respiratory center. It controls the heart and the respirations, or we can say that the lungs. So the symptoms related to the respiratory changes Okay, uncoordinated wall, hearing loss, personality changes, etc. So all these, and if there are the symptoms related to the brain tumor located in the cerebellum, so it lead to the increased intracranial pressure, vomiting, headache, and ataxia. So let's solve the now our main question, because all the basic point of the question we have seen. So see here, firstly, the symptom related to the increased ICP, I have explained you. Headache, confusions, shallow breath, nausea, vomiting, increased blood pressure, irritability, personality changes, etc. And here you can see the diagram. It is a condition of weary neck. So what is the meaning of the ray neck? Ray neck means the twisted neck. So this is the main symptom, sign and symptom of brain tumor in children. So how this can occur? So it lead to, you can see here, twisted neck. We can call it the twisted neck or the ray neck. As the tumor grows and occupies more space within the skull, it elevates the intracranial pressure. Okay, how this condition occur, I have explained that if like the tumor grows, as the tumor grows, it can occupy the more space in the brain. So it leads to the increased intracranial pressure, and this pressure can lead to the head twisting plus other symptoms. See here, nausea, vomiting, irritability, personality changes, headache. Okay, so all these symptoms seen in the child. So now I have explained you all the disease condition with the main symptoms. So let's select all the options. So firstly, we will see the right options. So nausea and the vomiting. So how the nausea and vomiting due to the increased intracranial pressure, because as the intracranial pressure increase, it lead to put a pressure on the vomiting centers, medulla oblongata, etc., and lead to the nausea vomiting. Then here, next option is fatigue and the lethargy. So fatigue and lethargy is also the sign and symptom of the brain tumor, because the client or the child will feel a very fatigued and lethargic due to the increased ICP. So here the option D is also right. Then vision, hearing, or the speech changes. So how the vision, hearing, and the speech changes, I have explained you that it lead to the on the basis of the tumor location in the different lobes. So when it will in the occipital lobe, so it can affect the vision, hearing, and the speech changes. Next is the seizures. So seizures, how it is also the sign and symptom of the brain tumor. And headache, it also lead to the increased ICP. Head tilt or the ray neck, it lead to the tumor, because the tumor occupies extra space in the brain. So to combat this condition, head tilt will be seen. So all these are the right options. Fatigue and lethargy is also due to the excessive nausea and vomiting. If the client lost his fluid from the body due to the excessive vomiting, he will automatically feel the fatigue and the lethargic. And bradycardia, here you have seen elevated pulse rate, but it is not the symptom. There will be seen the bradycardia, not tachycardia. It's seen the bradycardia. Because the brain tumor, if in our the brain stem, so we know that the medulla oblongata is the center of the heart and the respirations, or heart and the lungs. So it can lead to the decreased pulse rate. So tachycardia will be seen and tachypnea will be seen, not the elevated pulse. Skin rash is not the initial symptom or the classical symptom of this. Joint pain is also wrong option, and these all are the inappropriate options. So we can see the right option here: B, D, H, I, J, and L. Question number next. For a client with a T5 complete spinal cord injury experiencing symptoms such as a flushed skin, diaphoresis above the T5, high blood pressure, and a severe pounding headache, the following nursing intervention would be appropriate. Select all that apply. So let's recognize and find out the cues and the strategy. So condition given, we know all these. Firstly, we find out the condition. Here, T5 complete spinal cord injury means client has suffering from the spinal cord injury. And what are the symptoms? He is experiencing like a flushed skin. So we know flushed skin is due to the, sorry. So condition given the spinal cord injury and the client is experiencing symptoms like flushed skin, diaphoresis, high blood pressure, severe pounding headache. So in the previous questions, we have discussed about all these symptoms, and these symptoms are directly related to a disease condition, autonomic dysreflexia. Okay, so we have find out the condition, that is the autonomic dysreflexia, or it is also known as the hyperreflexia condition, that directly affect the autonomic nervous system, which include the parasympathetic and the sympathetic nervous system. So now the following nursing intervention, we have to select the appropriate nursing interventions for this autonomic dysreflexia condition. So let's see the options, like losing any tight clothing or the garments, implement cooling measures such as use a cooled or applying a cool pack to reduce excessive sweating, elevate the head of the bed at the 90-degree, conduct an assessment to determine there is a bladder distension or the bowel impaction, administer the appropriate antihypertensive medications as prescribed by the healthcare provider, and place the client in the supine positions with the legs elevated. So we know basically all the symptoms that I have explained you earlier in the previous NCLEX questions. So we have to now find out the correct interventions. So it is also a SATA-based question. Let's solve this question now. Okay. So firstly, see the definition of the autonomic dysreflexia. It is a serious medical emergency that occurs in an individual with a spinal cord injury, particularly those affecting the thoracic nerve of the spine, T6 or the above. So we can say that, like here the spinal cord, here the cervical vertebra, here the thoracic vertebra, here the lumbar, here the sacrum. So it is injury about the T6 vertebra or the above. So injury above the T6 vertebra. It is called as the autonomic dysreflexia, and in which there is lack of autonomic nervous system control. Okay, so this is the autonomic dysreflexia condition. So here you can see some symptoms like hypertension, vasoconstriction. All these are symptoms related to the stimulus below. So how all these can occur? So let's take an overview in 5 minutes. See here the brain, and here is the spinal cord. So here the T6 vertebra. So injury up to the T6 vertebra lead to the autonomic dysreflexia condition. So we know signal stimulations from the lower extremities controlled by the sympathetic nervous system, and in the upper body controlled by the parasympathetic nervous system. So when there ever with the injury in the thoracic 6 vertebra, no any signal or the transmission of the nerve to the brain by the lower extremities. Why? Because it will be blocked due to the injury of the T6 vertebra, and same condition, brain will not able to pass any signal or any message to the lower extremities. So here we know the sympathetic nervous system, as it is not affected, leads sympathetic nervous system control the vasoconstriction. It lead to the vasoconstriction. So when it is blocked, here's the vasoconstriction, and vasoconstriction directly lead to the hypertension condition. Okay, and it condition lead to more than 200 mm of Hg. And the pressure, whenever more than 200 mm of Hg, it leads to the pounding headache. So when all these conditions occur, the brain will stimulate the parasympathetic nervous system to combat the old condition. So here parasympathetic nervous system starts to control this hypertension or all this. So there will be the increase the venous return, or the sorry, it's lead to the venous return from the heart and venous return from the brain. So all these symptoms occur like the hypertension, pounding headache, okay, and other symptoms like the flushed skin comes due to the spinal cord injury up to the thoracic 6 vertebra injury. So now what would be? We have to take the interventions for the client suffering from the autonomic dysreflexia. Okay, so see this diagram. This is the high Fowler position. And the high Fowler position in which here the 90-degree elevated the bedside. So why we will administer this position to the client? To reduce the venous return to the heart and increase venous return from the brain. So it is the immediate nursing action when the condition develop or the symptoms occur like the pounding headache or flushed skin. In the questions we have given some symptoms. So whenever the RN assess these symptoms, so we have to do some emergency implications or the interventions here. And these interventions are firstly to put the client in the high Fowler position. Okay. So why? Because here I have mentioned to reduce the venous return to the heart and increase venous return from the brain. And this help to migrate the effect of the autonomic dysreflexia. So all these symptoms can be relieved by doing this. Okay. Rather than we can conduct the assessment for the bladder and the bowel distension. Bladder distension and bowel impaction. So RN have to make the emergency assessment for the distended bladder and the bowel impaction, because these conditions can trigger the autonomic dysreflexia. Okay, these both conditions can trigger the autonomic dysreflexia. So correcting any issue in the bladder or the bowel can help to terminate the episodes of this autonomic dysreflexia and prevent the further complications. So here, about the assessment of the bladder distension and bowel impaction. Next is here about, we know the condition hypertension due to the sympathetic nervous system vasoconstriction. Okay, so when there is severe hypertension, we have to administer the antihypertensive drugs to client. Because if the blood pressure is not controlled, then it can lead to the more complications like the stroke, myocardial infarction, seizures, etc. And so we have to administer antihypertensive drugs to reduce out the blood pressure of the client through the IV route under a proper medical supervision. Okay, so let's see the right options here. So you can see the first option, like losing any tight clothing or the garments. So this can provide like some relaxation to client when he is suffering from the hypertension. So this is a basic introduction. Like the constricting cloth can be lead to some vascular like the changes. So if we lose the any tight clothing or the garments, so it can provide a vascular support that aid to reduce or that help to reduce the blood pressure of the client. So it is the first intervention. Second option is C, elevate the head of the bed at the 90-degree, or we can provide the high Fowler position to the client because dependently to reduce the venous return to the heart and increase venous return from the blood. Next is conduct an assessment to determine if there is any bladder distension or the bowel impaction, because these conditions can trigger the autonomic dysreflexia. So we have to assess both these conditions. Next is administer appropriate antihypertensive medications as prescribed by the healthcare provider. So I have explained you that the more and the blood pressure. So we have to control the blood pressure of the client. So we have to administer the antihypertensive medication under the medical supervision through the intravenous route. And place the leg. So these options are the right options here, A, C, D, E. Place the client in a supine position with legs elevated. So this condition can more trigger to the autonomic dysreflexia, because this condition can lead to the increased venous return in the heart. So that is why this option is not appropriate. And implement cooling measures such as using a coal, applying a cool pack, or reduce the excessive sweating. So this can also not the appropriate option. It is not an appropriate option because if we directly apply some cooling measure or the cool cloth, so it will not able to reduce the hypertension, and it is not a like the priority intervention. So it is also not the appropriate option. So right options are A, C, D, and E. Next question here, the nurse is assessing a client understanding of the discharge training related to an Ileal conduit. Please select all the statements that indicate the client has correctly understood the teaching. Select all that apply. So we know the condition given, Ileal conduit related to client understanding. Okay, means client understanding related to Ileal conduit, and we have to select all that correct option that client correctly understood the stoma care. So let's see the options. I understand that it is important to maintain an adequate fluid intake to ensure the regular emptying of my ostomy pouch. I'm aware that I should typically change my ostomy pouch 3 to 7 days to maintain proper hygiene. I can place an aspirin tablet in my pouch to decrease odor. I will use the skin barrier or the protective barrier products to shield off my skin urine and minimize the risk of skin problems, I understood that I need to empty my ostomy pouch promptly when it's full of the prevent comfort and the potential leaks. I can use any size of stoma pouch without considering the fit or the proper management of my stoma. So firstly, we have to see about the condition. This ileal conduit. So it is made up of the section of the ileum, which is the part of small intestine. During an ileal conduit surgery, a segment of ileum is removed from the ball and one of the end is closed off while the other end is pulled through the urostomy and made into the stoma. These two ureter are sweet into the ileum, which forms a little pouch that diverts the urine out through the urostomy. Unlike the Indian pouch, the ileal conduct is not the content because of its small size, and urine is not collected and held in the pouch continuously flew out of the stoma. So you can see here, basically, ileum we know the part of the small intestine, and a segment of ileum is removed from the ball, and one end is closed off, and both the ureter are the sewed up into the ileum, and we can create it a urostomy. Okay, so extract out the urine into a bag, and you can see here it is a stoma, it is the ileal conduct and external ostomy bag. It is this blue color, the external ostomy bag attached with this stoma, and you can see here both the ureter are sewed into the ileum, and this is called as the ileal conduit. So there are some, after understanding the basic introduction of the ileal conduit, now we have to clear about the care of a stoma and the type of teaching given to the client regarding the ileal conduit. So firstly, if the client with ileal conduit, sorry, ileal conduit, we have to teach client about self-care activities. Okay, like how the stoma care, how to do stoma care or the ostomy appliance care. And so basically, firstly, there's some basic points related to the stoma care. To check the color consistency and presence of any infection under the stoma. Okay, and if there is a presence of any infection or the stoma, we have to immediately report the healthcare provider or to change the ostomy bag. So here, second is about the first stoma care. Second is about increase fluid intake. Okay, and avoid limiting fluid because if there will be the sufficient hydration, it lead to the proper maintenance of the ileal conduit. Third is about maintenance of hygiene of pouch because it should be changed in the it should be changed within 3 to the 7 days, or if any leakage occur, because if you will not change in this changing protocol period, so it can lead to some itching, burning, irritability in the skin surrounding the pouching system. So that is why here. Next is about to protect skin from urine secretion. because urine secretion can lead to the itching, irritation in the skin. So clients should always use a skin barrier or clean the stoma daily with the water, because if he will not use the skin barriers, the condition can lead to irritation, itching, infection, etc. So here. And next is about here. To check leakage. So all these are the basic some care or teaching education for the client if he's receiving, he's on the Ileal conduit. So let's see the right options here. So A option, I understand that it's important to maintain an adequate fluid intake to ensure the regular emptying of the my ostomy pouch. So it is the right option because I have explained you. To maintain the proper stoma health, the client should be instructed to increase the fluid intake approximately 3000 ml per day. Okay, because sufficient hydration assists in the flushing mucus from the ileal conduit. So option A will be the right here. Option B, I'm aware that I should typically change my ostomy pouch every 3 to 7 days to maintain proper hygiene and prevent skin issues. So it is also very important, like if the ostomy pouch change within 3 to 7 days, so we can protect the client from the we can protect the client from the infection. So the proper hygiene maintained and prevent the skin issues. So we should teach the client about changing protocols of the ostoma within 3 to 7 days. And next here, option number D is also the right. I will use a skin barrier, protective barrier. So we know to protect the skin from the urine irritation, the client should use a skin barrier. And we have to also teach the client to clean the stoma and the surrounding skin with water and the soap if sufficient. And so option A, B, D is the right option here. A, B, and D. C, I can place an aspirin tablet in my pouch to decrease odor. So it is noted here, like the aspirin should not be utilized for the odor control. It can irritate the stomach and potentially lead to the ulcer formation. So it is not an appropriate option to placing an aspirin in the bag. And sorry. And this is also like I can use any size of stoma. So it is also an inappropriate option. Why the inappropriate option? Because using a correctly fitting pouch system is the very optimal for the comfort, waste management, and prevention of the leakage. So any size of stoma is not the appropriate option because the proper size of the stoma according to the fitting or according to the waste management or prevention of leakage. So we can use the proper size stoma. And I understand that the emptying pouch is promptly when it is full to prevent the discomfort and the potential leakage. So it is also not the appropriate option. So option A, B, and D is the right option regarding the client's teaching of the discharge related to an ileal conduit. So this is about the today's NCLEX questions. Thanks.